And I know that there were two dueling plans to bring down healthcare costs, and I want to talk about them and get your thoughts on them. We'll start with Democrats. Democrats in the Senate wanted a 3 year extension on the premium tax credits. That sounded like a temporary fix. What do you think of that? Because that would expire in 3 years.
Well, I think that we're going to have to throw lifelines to people that need it until we solve the problem. But the problem is, this doesn't solve the problem. And there's nothing moving forward that actually solves the problem for all Americans. We can't be competitive as a country when 60% of our healthcare costs are being paid by employers, and our healthcare costs cost more than wages do in other countries. So we have to really think about, I mean, do what we can. We have to help the people we can help. But our deficit spending, right, which is, $1.5 trillion per year, we could solve that problem just by getting down to the next less expensive country. Right. Just to be as cheap as Switzerland, which, by the way, they live 5 years longer, than we do, and have much better outcomes. So we've got to really fix the bigger problem. But in the meantime, we've got to throw lifelines to the safety net. We've got to throw lifelines to people. I mean, nobody can afford insurance anymore. And we have the employers paying it, but most of these people are not, they're self-employed, they're entrepreneurs. We have to protect them as well.
And before I even get to the Republican health plan that ultimately failed, I want to talk about how do you think that we could fix the bigger problem? Because I'm sure you have talked to countless people. I know I have talked to people all throughout the country. Some people have said, I time strategically taking my medicine so I can cut down on getting medicine. I can buy it less frequently. Other people have avoided the doctor, going to the hospital, addressing health concerns because they're like, I can't afford that right now. How do you address the bigger problem of bringing all health care costs down?
It's a great question, because what we've done historically is we target one sector. So we'll target the hospitals, right? And then outpatient costs go way up. And then we'll target the doctors, and hospital costs go up. And so we're just moving the money around, right? We're not actually solving the problem. And we need to, and we need the patients to be in it as well, not by reducing the medicine they take, but by being more conscious about their diet and exercise. So, where the administration has come in on health, that's an important part of fixing the problem. Is our obesity rates are higher than the rest of the countries. We are a sicker population because of our own responsibility. But then we have to find a way where every single sector is incentivized, right? And right now, every single sector of both insurers and providers have greater incentives to increase the cost of care than to reduce it. And we have to change the incentives, and we don't even have a glimmer of a plan to do that yet.
And to that point, President Trump has said before that he thinks insurance companies are ripping people off. He wants to put money directly in the individual's pockets opposed to insurance companies. And that seems to be in lockstep with the GOP plan. The GOP plan essentially, I'm going to boil it down here, it would let the enhanced ACA tax credits expire and instead replace them with direct payments of up to $1,500 to the HSA accounts of people enrolled in the high deductible plans. What do you make of that plan? Do you think that that's addressing the bigger problem any better?
Well, I mean, a lot of people don't have HSAs, so that's kind of a problem right there, right? And so you have to sort of be in a certain structure to even have an HSA. And the HSAs tend to be with people that have higher incomes and can sort of afford to park money. So it's, again, it's, even if it's $1,000, $1,500, okay, the total healthcare costs are still $15,000 a year. Right. So it will maybe give you a little bit, but it's not going to solve the problem. And it's still going to cost a lot of money. And it's not going to do anything to bring down healthcare costs. It will take money, again, from what, okay, I won't give the money to the insurance company, but I'm going to give it to the providers with my out-of-pocket costs. Those same out-of-pocket costs would have been covered by the insurance providers. We're not fixing anything. We're just moving money away, and fewer people will be eligible for that. So I don't know if that's the answer either. I don't think there are any answers on the table right now, I'm sorry to say.